signs of heart attacks in women. So if you can identify what are some maybe usual or unusual warning signs of heart attacks in women, if you can identify that.
So heart attack in a woman, women still present with chest pain as the most common symptom. I've had people tell me, well, I had chest pain and I know heart attacks in women are different, so they ignore the chest pain because they thought of that. Chest pain is still the number one presentation, but women often present slightly differently. Shortness of breath is a common symptom in women. It can accompany that chest pain, but it can be on its own. Nausea or the common bad feels that the Bayesians would speak of. And then some very weird symptoms like just feeling bad, just feeling like you're going to die, sweating, abdominal pain, diarrhea. Those are symptoms that all of them can occur both in men and women. So interestingly enough, working with women over the years, I've realized that women and men kind of speak differently. They have different ways of expressing themselves. So a woman would spend, 20 words trying to pin down the exact sensation they're experiencing, and it ends up sounding as though it's an atypical thing, but the man would say, I'm having chest pain. So, and that's why sometimes it sounds as though women's symptoms are atypical, whereas they are so in touch with the full range of every symptom they're experiencing. The man may be experiencing some of those, but they just pinpoint one and leave it at that. So the important thing is when someone presents with an acute symptom that is associated with that is worsening with exertion, and is part of that constellation of chest pain, shortness of breath. We should take note.
Okay, all right. Do heart attacks come on suddenly, or does it affect an individual over time? How does it really happen?
I'll take a step back and explain what a heart attack is. A heart attack is a sudden occlusion of a blood vessel, artery that supplies the muscle of the heart. So that artery is bringing oxygen-rich blood to help the heart work. When a heart attack occurs, a cholesterol plaque, which could be minor or major, rupture. So the lining overlying that plaque separates the cholesterol pool from the blood. But when that plaque ruptures, the body senses that rupture as a wound, and like when you bleed, when you get a cut and you bleed, your body just starts up all of these pathways in order to close off the wound and clot off the wound. So that's what happens inside the blood vessel. Even though it's inside the body, it clots off the wound, which unfortunately lead to clotting off of the blood vessel and complete occlusion. That is an acute event. It happens suddenly. But what can occur is that plaque underlying the clot can present with varying degrees of symptoms. So it may be that it was a non-obstructive plaque and the person had no symptoms at all, but with varying degrees of severity and varying degrees of obstruction, people may have had warning signs. So they may have had that chest pain on exertion, shortness of breath on exertion, fatigue. So if you're, I guess, lucky enough to have those warning signs, you should take note, because presentations and manifestations of cardiovascular disease should always be taken seriously.
Okay, I read that there are types of heart disease. What are some of the main types of heart disease in women, if you can identify?
So I guess once again, women can have pretty much all the same types of heart disease that men can have. So ischemic heart disease is number one cause of cardiovascular disease in women, and of course hypertensive heart disease, especially in our population where hypertension is so rampant. But there are some interesting conditions that are more common in women. There's something called Takotsubo or apical ballooning syndrome, which is also known as a stress-induced cardiomyopathy or broken heart syndrome. So I just gave you 4 names for the same condition. And this is the woman who had a stressful event, buried her husband, and then had a sudden heart attack. But when we go in and we look at the blood vessels are fine. And these conditions are not as benign as it sounds. Women can actually die from that. So that's an acute presentation. There's another type of a heart attack called a spontaneous coronary artery dissection that's significantly more common in women, where there's a tear in the lining of the blood vessel that's not associated with cholesterol plaque. And it came to light because it was occurring in women after pregnancy, soon after pregnancy. But then when people started studying it, they realized that it could occur at any point in time in a woman's life. It's just when women present after pregnancy with a heart attack that becomes very obvious. People pay more attention. And there are some familial things that increase the risk for that. That's people in the same family can present with that condition, and it can be associated with other conditions that can be genetic as well. So those are some of the more common things. And then something else that we pay attention to, I know that you had this as one of your questions later on, I think it's worthwhile to raise here. Women have this special stress test called pregnancy, where if they are predisposed to cardiovascular disease, it can be uncovered during or immediately after pregnancy. So if during pregnancy they have risk factors for hypertension and diabetes, they can develop hypertension in pregnancy, develop diabetes in pregnancy, and those can then lead and predispose to long-term cardiovascular disease. And then there are a few conditions that can occur more so in pregnancy. Just in pregnancy, something called peripartum cardiomyopathy. But you understand it's something that occurs around the time of delivery. So that's a condition, obviously, that's only going to occur in women. Okay.
All right. Is heart disease in women hereditary? So for example, if my mom had heart disease, is there a higher risk for me to get heart disease? Does it work that way, or is it more environment, diet, that kind of thing, factors?
Cardiovascular disease risk factors, there are 5 top risk factors, and family history is one of them. So not necessarily, family history in your female relative, family history in any of your disease, then your risk is higher. And a lot of that is mediated by the other risk factors as well. So diabetes tends to be hereditary, high cholesterol and familial hyperlipidemia can be hereditary. But even when you take out those risk factors, a family history is still an independent and major risk factor for the development of atherosclerotic cardiovascular disease.
Okay. All right. You may have covered this, but does the heart disease affect women differently in comparison to men? Is it a matter of an age thing, or maybe your genetics, how men and women are built? Does it affect men and women differently?
Yes. I haven't dealt with that specifically yet. So men tend to present with heart attacks, ischemic heart disease, and at an earlier age. Women, by virtue of having estrogen, are actually protected from atherosclerotic cardiovascular disease early on. So as you reach menopause and those estrogen levels wane, then women tend to start catching up with men, but they never quite catch up. So on average, if a man is going to present with a heart attack between the ages of 40 and 60, a woman will present between the ages of 50 and 70. So women present 10 years later with heart disease than men will. When I say heart disease, I mean ischemic heart disease. But then also, women often present with small vessel disease. We call that microvascular disease, whereas men present with disease of the more major coronary arteries. So they'll present with a heart attack, whereas women will present with angina. So when I speak of small vessels, as the blood vessels that surround the heart get progressively smaller and smaller, and then they go into the heart muscle, and these are vessels that we can't see when we do our test. Women are increased risk for those blood vessels having disease. And we think some of it may have to do with, of course, women's hearts are smaller, so those blood vessels are smaller, so they're more at risk for blockages. But then there may be the impact of hormones and the impact of the way that women's hearts respond to stress. So again, heart failure, when we look at heart failure, which is heart muscle disease and insufficiency of the heart muscle, men tend to present with weakness of the heart muscle, where a heart attack has caused damage or hypertension has caused damage and the heart muscle is weakened. Whereas women tend to present with stiffness of the heart muscle because they tend to respond more with thickening and stiffness in response to that hypertensive stress. And as we get older, women's hearts tend to stiffen out a little bit, or stiffen a little bit more readily than men. And that also leads to microvascular disease. So it's a complex area of study, very, very interesting. But it tends to present, when you go on the hospital wards, women with heart disease tend to be older than men. And women tend to have what we call the heart failure with preserved ejection fraction, and men heart failure with reduced ejection fraction. And it's important to understand the differences in presentations, because it then leads to differences in treatment, which is where that whole Go Red for Women campaign came about. We're trying to treat women with the same way as we're treating men, but because men present differently and they have slightly different morphologies and presentations of heart disease, we're treating that and it's not working for the women, and we're wondering why. And it's because women's heart disease is a different entity in some instances.
Okay, we're down to our final two, by the way. All right, so you mentioned pregnancy and heart disease. Is the risk ultimately higher when you're pregnant for heart disease, or at least a heart condition?
The risk is that uncovering of the underlying predisposition. So if you have underlying heart disease, you're someone who had a congenital condition, were born with a hole in the heart, or you have a valve dysfunction. When you're pregnant, that can be uncovered because of all the stresses and strains of pregnancy on the cardiovascular system. So, then women can present with symptoms during pregnancy because of that underlying condition. And then again, we go back to those underlying predispositions for hypertension and diabetes, etc. So, on the surface of things, yes, you could see an increased risk for heart disease during pregnancy, but that's because of that stress test that pregnancy imposes on the woman's body. If they then develop the heart disease, that means that they have kind of failed that stress test. And it's that they had that disease, it's just we're now seeing it during pregnancy.
Okay, this is the final question. So based on what you've mentioned so far, what's some of the symptoms that you say, well, look, you need to go to the doctor immediately, you should seek urgent medical care as a woman?
Any acute symptom related to heart and lungs, etc. So acute chest pain, acute shortness of breath, acute palpitations. So palpitations is a sense that your heart is racing or skipping a beat or something like that. Those are, especially if the palpitations are associated with that shortness of breath and chest pain. More subtle presentations, so you've been going along, you notice that ever so often, hey, I'm getting this chest pain on exertion, or this shortness of breath on exertion. Again, that requires some kind of evaluation, but that may not be as urgent as that acute onset. So you are, sitting, minding your own business, and all of a sudden you get this severe central crushing chest pain that's radiating to the jaw or the back, associated with shortness of breath. That's a classic presentation of a heart attack. Sudden onset shortness of breath that is associated with sweating or feeling of general ill health. Again, seek medical attention. If you feel suddenly bad and you can't quite figure out what's going on, that's something to seek medical attention over.